The sensation of your feet on fire while you lie awake at 3 in the morning, not mild discomfort, genuine burning, a prickling sensation that persists hour after hour without relief, such profound numbness that you cannot detect the surface beneath your soles. Or perhaps the most disturbing experience, the feeling that your every step crushes shards of glass into your skin, agonizing, constant, inescapable, yet when you look down, there is nothing there at all. If you recognize any of these descriptions, what follows is information you absolutely must understand. 25% of individuals above 70 years of age experience these exact symptoms on a daily basis. Not intermittently, not when fatigued, but continuously every 24 hours. The vast majority make an identical error. They visit their local drugstore, purchase an analgesic medication, select some glossy packaged B-complex vitamins, and temporarily suppress the signal. The discomfort diminishes somewhat, then returns, then intensifies, because pharmaceutical intervention addresses only the surface manifestation, not the underlying pathology. The medication effectively disconnects the smoke detector while the structure continues to combust. What I am preparing to explain will not be volunteered during your standard clinical visit. The healthcare economy does not financially incentivize your recovery. Its revenue structure depends on your continued return visits. If this perspective resonates, engage with this content and help expand this educational platform. We are constructing something genuinely valuable. Throughout 15 years of clinical practice, I have evaluated hundreds of individuals who spent years navigating between specialists, accumulating prescriptions, depleting financial resources, and gradually experiencing progressive sensory loss throughout their lower extremities. The answer was never pharmacological. It resided in deliberate physical activity. I will demonstrate precisely what that entails, supported by the underlying biochemistry, not merely motivational rhetoric. Before demonstrating specific techniques, you need to comprehend the actual physiological process occurring within your tissues. Understanding the mechanism, the genuine biological cascade, reveals why physical exercise produces therapeutic effects where pharmaceutical agents fail. Your peripheral nervous system functions as an elaborate wiring network. Imagine a fiber optic cable extending from a central hub, your spinal column, outward to terminal devices, specifically your feet and individual toes. These cables transmit signals continuously: pain perception, thermal sensation, pressure detection, vibratory awareness, and most critically, your body's spatial orientation sense, what clinicians call proprioception. When this cable network remains intact, signal transmission is pristine. Your brain receives precise data and responds instantaneously. You redistribute your weight fractionally. Your body compensates automatically. You encounter an irregular surface, your foot self-corrects without conscious awareness. When the cable sustains damage, signals become distorted or cease entirely. Your brain receives static instead of clear information or complete silence. That static manifests subjectively as burning and tingling sensations. That silence registers as numbness. This pathological condition carries the medical designation peripheral neuropathy, literally meaning damage to the peripheral nerve structures, those extending from your spinal column outward throughout your limbs. Now let us address causation directly, because countless patients spend years without identifying what is actively destroying their nervous tissue. The predominant cause is diabetes mellitus. Diabetes accounts for approximately 40% of all peripheral neuropathy diagnoses globally. The mechanism is straightforward and devastating. Chronically elevated blood glucose initiates a biochemical process termed glycation. Glucose molecules chemically bond to proteins within nerve sheaths, permanently distorting their structure. The nerve loses its capacity for normal electrical conduction. Simultaneously, diabetes progressively damages the microscopic blood vessels supplying nerves, creating a state of tissue starvation. Two concurrent attacks on identical structures. This explains why diabetic neuropathy represents one of the gravest complications of diabetes, and why glucose regulation is medically mandatory for nerve preservation. However, diabetes represents merely one culprit among many. Alcohol consumption damages nerves through dual mechanisms. First, ethanol is directly neurotoxic, degrading cellular membranes. Second, it interferes with intestinal absorption of thiamine, vitamin B1. Thiamine essentially serves as nervous system fuel. Without adequate thiamine, nerve function deteriorates. I have encountered patients describing their consumption as moderate, perhaps 1 or 2 drinks nightly, who nonetheless develop significant neuropathy through precisely this mechanism. The term moderate conceals considerable variability. Vitamin B12 deficiency constitutes its own distinct concern and occurs far more frequently than generally recognized. B12 is biochemically essential for myelin synthesis, the protective insulation surrounding each nerve fiber. Without myelin, a nerve resembles an uninsulated electrical wire. Signals leak, short circuit, and become scrambled. Here is a crucial point that many physicians entirely overlook. 2 extremely common medications significantly reduce B12 absorption. Metformin, the world's most widely prescribed medication for type 2 diabetes, and proton pump inhibitors like omeprazole, medications for acid reflux and gastritis that millions consume daily for years continuously. If you currently take either medication, obtain laboratory measurement of your B12 concentration, not as a precautionary suggestion, as an absolute medical necessity. Chemotherapy agents damage nerves as a documented adverse effect, particularly platinum-based compounds and taxane drugs. Autoimmune conditions involve your immune system erroneously targeting the myelin sheaths of your own nerve fibers. Obesity establishes chronic low-grade systemic inflammation that progressively degrades nerve tissue over extended periods. And here is a statistic that genuinely surprises most people. In 30% of cases, physicians cannot identify any causative factor whatsoever. The neuropathy is objectively real, symptoms are genuine, nerve damage is measurable through diagnostic testing, yet no explanation exists. This carries the designation idiopathic neuropathy. It occurs more commonly than most patients are informed. Now let us discuss nutritional supplementation. I will maintain a strictly factual, concise approach. No promotional language, only published data. Alpha-lipoic acid functions as an antioxidant compound, a molecule that neutralizes free radicals, unstable molecules that damage nerve cells. Multiple clinical trial series, including the Sydney trials and the Nathan trials, tested alpha-lipoic acid on hundreds of patients with diabetic neuropathy under controlled experimental conditions with placebo comparison groups. Rigorous scientific methodology, not anecdotal case reports. The outcome? A 30 to 50% reduction in pain and tingling sensations. This does not represent alternative medicine. These are randomized, controlled trials. The dosage that produced this effect was 600 milligrams daily. Higher doses of 1200 and 1800 milligrams did not produce meaningfully superior results, but did generate increased adverse effects. 600 milligrams represents the optimal dosage. If you have diabetes, consult your physician before initiating supplementation because alpha-lipoic acid affects blood glucose concentrations, and your medication dosage may require adjustment. Vitamin B12 requires laboratory testing. It is a simple blood test. If your concentration measures low, restoration can arrest neuropathy progression and in certain cases produce reversal. This is particularly relevant for anyone prescribed metformin or a proton pump inhibitor. And here is the fact that consistently astonishes my patients. Vitamin B6, identical to the supplement marketed at every pharmacy as supporting nerve health, identical to the ingredient included in dozens of popular multivitamin formulations, in doses exceeding 50 milligrams daily, actually causes neuropathy. It generates the precise condition you are attempting to treat. This is designated B6 toxic neuropathy and is extensively documented in medical literature. Right now, before this presentation concludes, examine the label on any multivitamin you currently consume. Verify the milligram quantity of B6 it contains. Many popular formulations contain 100 milligrams or higher. That does not constitute treatment, that constitutes inadvertent self-poisoning. Now, to the central subject. In 2015, researchers at the University of Utah obtained skin biopsies from patients with neuropathy. A biopsy means they extracted a tiny tissue sample and examined it microscopically. They quantified the nerve fibers present in the samples. Subsequently, the patients participated in a structured exercise program. Following the program, researchers obtained new biopsies, and the quantity of nerve fibers in the skin had increased measurably. Not merely subjective reports of improved sensation, though that also occurred and matters significantly. The researchers observed actual physical growth of nerve tissue, visible under microscopic examination. New nerve endings where none had existed before the program. This phenomenon is termed nerve fiber regeneration, and this is precisely what occurs when you perform the appropriate exercises consistently. This was paradigm-shifting research. For decades, medical consensus held that adult nerves do not regenerate. Conventional teaching was that damage was permanent, and the therapeutic goal was symptom management, not tissue recovery. That consensus was incorrect. Under appropriate conditions, nerves regenerate. The appropriate conditions are created by movement. Specific movement performed correctly, performed consistently. There are 6 exercises across 3 categories: cardiovascular conditioning, balance training, and targeted footwork. Everything I will demonstrate can be performed at home. You need a sturdy chair with a firm seat. That is the entire equipment requirement. 15 minutes daily. The first category is cardiovascular exercise, and I want you to understand something explicitly. Cardiovascular work is not supplementary here. It is foundational. It was aerobic exercise that drove the nerve fiber growth in that University of Utah study. Without cardiovascular work, the other 5 exercises produce approximately half the therapeutic effect. The reason is twofold. First, aerobic exercise increases blood perfusion. Nerves receive enhanced oxygen and nutrient delivery. Second, it stimulates release of a protein in muscle and nerve tissue, designated brain-derived neurotrophic factor, abbreviated BDNF. Consider BDNF as fertilizer for nerve cells. It stimulates their growth, maintenance, and repair. The more you engage in aerobic movement, the more of this protein your body synthesizes, and the more actively your nerves can recover. The target is 150 minutes of moderate intensity aerobic activity weekly. This represents the World Health Organization recommendation for neuropathy based on data from multiple large-scale studies. Walking, stationary cycling, swimming, any movement that is comfortable and does not provoke pain. However, here is one specific exercise you can perform immediately indoors without leaving your residence, without any equipment, with 0 fall risk. Sit in a sturdy, firm-seated chair. Sit upright. Do not rest against the backrest. Your core musculature needs to be actively engaged. Begin alternating knee lifts as though you are marching in place. Add your arms. When the right knee elevates, the left arm moves forward, precisely as it would during normal ambulation. This cross-body coordination is deliberate. It activates both cerebral hemispheres simultaneously and strengthens neural connections. Your pace should be sufficient to slightly elevate your respiratory rate, but you should still be able to speak in complete sentences. Start with 3 minutes. Every 2 to 3 days, add 1 minute. Your target is 10 to 15 minutes per session, twice daily. That is 20 to 30 minutes of cardiovascular work every day with 0 fall risk. Cardiovascular exercise initiates recovery from the inside, but there is a problem that cannot wait for recovery because it is dangerous presently. Damaged nerves lose their ability to sense foot position in space. This is why people with neuropathy fall. Research demonstrates that people with peripheral neuropathy have double the fall risk of people without it. The next 2 exercises can literally prevent you from fracturing your hip, and I mean that with complete seriousness. For someone over 65, a hip fracture means surgical intervention, prolonged rehabilitation, and in a substantial percentage of cases, a sharp and lasting decline in quality of life. Neuropathy disrupts proprioception. That term is worth understanding. Proprioception is your body's ability to sense its position in space without using vision. It is the 6th sense rarely discussed, and without it, normal ambulation is impossible. When you walk on an uneven surface without looking at the ground, proprioception is what maintains your upright position. When the nerves are damaged, that signal weakens. The brain receives a blurred picture and cannot correct your balance in time. The result is a fall. The good news, proprioception can be trained precisely the way a muscle can be trained. Stand behind your chair, holding the backrest with both hands. Shift your weight onto your right foot. Lift your left foot slightly, just 2 to 3 centimeters off the floor. That is all. Just stand there. Your goal is 30 seconds on each leg, 3 sets on each side. If you can only hold 5 seconds right now, that is completely acceptable. Start with 5 seconds. The nervous system does not respond favorably to sudden large loads. It needs gradual progression. Each day, add a few seconds. When 30 seconds becomes easy, remove one hand from the chair. When that becomes easy, remove both hands. When you can stand without holding anything, close your eyes. That is where the real training begins. With your eyes closed, your brain loses its visual reference and must rely entirely on those damaged nerve pathways. They begin working at full capacity like a weak muscle under load. It is difficult, and that is precisely why it is effective. Studies on balance training with eyes closed have shown significant improvement in as little as 2 weeks of daily practice. The next exercise is called heel-to-toe rolls. Stand with your feet shoulder-width apart, one hand on the chair back. Slowly shift your weight back onto your heels. Let your toes lift slightly off the floor. Hold for 1 to 2 seconds. Feel the pressure distributed along your heels. Then, slowly roll forward onto the balls of your feet and your toes. Heels come up, hold, roll back. 15 repetitions, 2 sets. Slowly. This is about control, not speed. Every roll sends a signal from the sensory receptors in the soles of your feet up through the spinal cord to the brain. I am here. I feel the floor. I am in contact with the ground. This exercise does 3 things simultaneously. It trains balance, strengthens the calf muscles, and stimulates the mechanoreceptors in the soles of your feet, specialized nerve endings that respond to pressure and movement. 3 effects from 1 movement. These 2 exercises, single leg standing and heel-to-toe rolls, take about 5 minutes total. Do them every morning. Do them while your coffee brews. Non-negotiable. Now, let us go deeper. In neuropathy, it is not only sensory nerves that are affected, the ones that transmit sensations. Motor nerves are affected too, the ones that command muscles. The small intrinsic muscles of the foot gradually atrophy because the motor nerves stop delivering instructions. The foot loses its shape, your gait changes, load redistributes incorrectly, and you start getting pain in the knee, the hip, the lower back. This is not coincidence. It is a chain reaction that starts in the foot. The next 3 exercises wake up exactly these dormant muscles and nerve endings. Exercise 4, calf raises. Stand holding the chair back. Slowly rise onto the balls of your feet and your toes. At the top, pause. 1, 2. Slowly lower. Do not drop your heels. Lower under full control. At the bottom, 1, 2. 12 repetitions, 2 sets, 30 seconds of rest between sets. Why does this work specifically for neuropathy? 2 reasons. First, blood flow. Your calf muscles are the venous pump of your legs. When they contract, they push blood upward through the veins. When they relax, fresh arterial blood carrying oxygen flows down to the feet. Nerves are fed by tiny blood vessels, and when you work your calves, you are literally delivering oxygen to your nerves with every contraction. Second, neural training. Every rise and lower sends a proprioceptive signal from the soles of your feet through the spinal cord to the brain. You are training the entire nerve pathway from the ground up. When 12 repetitions become easy, try the movement on a single leg. That is a significant progression. Do not rush to it. Exercise 5, towel crunches. Sit on the chair, lay a thin towel flat on the floor in front of you. Remove your shoes and socks. Place one bare foot on the near edge of the towel. Now, using only your toes, grip the fabric, curl it toward you, pull it in. Spread your toes, grip again, curl, pull. 10 repetitions per foot, 2 sets. At first, the toes will not cooperate well. The movement will feel clumsy, weak, uncoordinated. This is completely normal. In fact, that difficulty is the point. You are activating neuromuscular pathways that have been dormant. Your brain is literally relearning how to command these muscles, building new neural routes through the fibers that still function. Every session, it becomes a little more coordinated. This is not a psychological impression of improvement. It is actual recovery of neural connections. When this gets easy, place small objects on the floor, pennies, pencils, small rubber balls, and pick them up with your toes, moving them from one pile to another. This is fine motor training for the foot, and it activates even more nerve endings than the towel alone. Exercise 6. Ankle circles and the alphabet. Sit on the chair, lift one foot slightly off the floor. Rotate the ankle in slow, full circles. 10 rotations clockwise, 10 counterclockwise. Slow, maximum range of motion. Feel the full range of the ankle joint. Then, the best part. Using the tip of your big toe as a pen, write the letters of the alphabet in the air. A, B, C, D. Take your time. Write large and clearly. Each letter is a unique movement trajectory that engages different muscle groups in the lower leg and foot at different angles. This is full functional training in a seated position. This exercise in particular tends to become a favorite among my patients with neuropathy because it is easy to do and many notice real improvement in ankle mobility within just a few days. Now, before I bring this all together, I want to address something important. The nervous system's capacity to respond to these exercises is significantly influenced by age. After 50, the rate of nerve fiber regeneration slows to roughly half of what it is in younger adults. That is simple physiology, not a diagnosis, not a sentence, but it is a clinically meaningful factor. A 40-year-old and a 70-year-old need different intensities, different pacing, and different time expectations for results. I want to understand who is watching this channel. Drop your age in the comments below. It will directly shape the content I produce next. Let me see what age groups are dealing with this, and I will tailor the coming videos to exactly where you are. Now let us put all of this into one daily routine. Not a complicated program you have to keep reading from notes, but a simple habit that fits into your day. 15 minutes every day, 3 blocks. Block 1, warm-up and cardio. Seated marching, 5 to 10 minutes. Your breathing increases, blood begins to move actively, your nerves receive oxygen. This is your ignition. Block 2, balance. Single leg standing, 30 seconds per leg, 3 sets per side. Heel to toe rolls, 15 repetitions, 2 sets, 3 to 4 minutes total. This is your fall prevention. Block 3, feet. Calf raises, 12 repetitions, 2 sets. Towel scrunches, 10 repetitions per foot. Ankle circles and alphabet, 10 rotations each direction, then the full alphabet. 4 to 5 minutes total. This is your nerve stimulation work, and whenever weather and energy allow, add a 20 to 30 minute walk at a comfortable pace. It compounds with the home program and amplifies the effect, but it does not replace it. 3 rules that determine whether any of this works. And I say this from watching patients give up in the first week because they violated exactly these principles. Rule 1, start at half load. If the instructions say 12 repetitions, do 6. If it says 30 seconds, start with 10. The nervous system does not respond to sudden large jumps in demand. It responds to gradual, progressive increases. And that progressive loading is precisely what triggers regeneration. Add a little each week. Rule 2, every day without exception. Consistency matters more than intensity. 15 minutes daily is dramatically more effective than 1 hour once a week. Nerves regenerate slowly. The process cannot be accumulated in one long session. It requires continuous daily input, day after day. Most people notice the first tangible improvements within 2 to 4 weeks. Stable, lasting improvement typically appears between 8 and 12 weeks. Do not expect a transformation in 3 days. But do not quit before the process has had time to work. Rule 3, inspect your feet after every session. This is not excessive caution. This is a medical requirement. When pain sensitivity is reduced, an injury, a blister, a friction sore, a small cut can happen without you ever feeling it. You will not feel the pain. The wound will develop and deepen while you go about your day until you notice it visually. This is especially critical for people with diabetes, where even a minor foot injury can escalate into a serious problem quickly. 1 minute of inspection in good lighting after each session. That is your safety protocol. What else you can do right now beyond exercise? First, get your blood tested. Fasting blood glucose, hemoglobin A1C, which reflects your average blood sugar level over the past 3 months, and vitamin B12. Those are 3 tests that anyone with neuropathy symptoms should have. Second, discuss alpha-lipoic acid with your doctor. 600 milligrams per day, clinical evidence behind it, dozens of controlled trials. Not a cure, but a real evidence-based tool for reducing pain and tingling. Third, Review your diet. Fatty fish, salmon, mackerel, sardines twice a week. Leafy greens, nuts, legumes. Cut sugar and trans fats sharply, not for weight loss, but for neuroprotection. Fourth, check every supplement and multivitamin you take for vitamin B6 content. If any product contains more than 50 milligrams, replace it. Neuropathy is not a life sentence. It is damage that the nervous system is capable of responding to if you give it the right conditions. You now have a specific, concrete plan. Not try to exercise. 6 specific exercises with clear, documented mechanisms of action. Start today at half load. 3 minutes of seated marching, 10 seconds on one leg. The most important step is the first one, and the second most important is not stopping. One last point, if you have open sores on your feet, severe loss of sensation, or serious balance problems, speak to your physician before beginning. Those situations require individual assessment and supervision, and any good doctor will tell you the same. The official medical system does not benefit from you doing this at home and getting better. A patient who recovers stops making appointments. A patient who stays symptomatic keeps coming back. I have spent 15 years watching that dynamic play out. Engage with this content and help this educational platform reach a wider audience, because every person who finds this information is one fewer person silently losing their quality of life to something they could have reversed.